Very short answer questions. Growth is controlled by many factors. Name them. UNS. Growth is controlled by genes, endocrine secretions, food, exercise, rest, relaxation, and sleep. Define maturity. UNS. Maturity is indicative of one's readiness to share adult experiences, privileges, and responsibilities. Name the different aspects of maturity. UNS. The different aspects of maturity are chronological maturity, physical maturity, intellectual maturity, emotional maturity, social maturity, and philosophical maturity. Chronological maturity is important in what respects? UNS. Chronological maturity is important for getting the right to vote, inheriting property, obtaining a driving license, getting married, opening a bank account, etc. What does philosophical maturity include? UNS. Philosophical maturity includes long-term values, goals worth striving for, making true friends, and having a dedication and mission in life. When do one gain physical maturity? Can it be altered? UNS. One gains physical maturity when one has obtained his full height, weight, and strength. Proper nutrition and physical exercise can help but not altogether change the pattern of physical growth. Why is compatibility an important requisite in marriage? UNS. Compatibility is essential for making a married life happy. Two persons who marry cannot have exactly the same traits. Individual differences can always be there, the couple must accept and live with their differences. What is the main function of the white blood cells? UNS. The main function of the white blood cells in the blood is to help defend the body against a sudden attack of germs. What are antigens and how do they function? UNS. Germs contain certain chemical substances called antigens. Antigens make the body produce other substances called antibodies, which protect us from diseases. Who is susceptible to diseases? UNS. A person who is in poor health, undernourished, in fatigue and with severe physical and mental strain is susceptible to diseases. What is the full form of DPT? UNS. DPT stands for diphtheria, pertussis and tetanus. What is anaphylaxis? UNS. In some cases of passive immunization, there will not be any violent reaction for the first dose. But the individual is rendered intolerant to a second dose. This condition is known as anaphylaxis. What are toxoids? UNS. Certain germs like diphtheria and tetanus produce poisons which when made harmless are used for producing immunity. These are toxoids. What is natural immunity? UNS. Natural immunity is the resistance offered by the body under normal conditions without any prior infection or external stimulation such as vaccination or inoculation. What is natural acquired immunity? UNS. An immunity is called acquired immunity when a previous attack of the disease gives a certain amount of immunity from another attack of the same disease, as in the case of chickenpox. What is passive immunity? UNS. It is called passive immunity when antibodies produced in some other person or animal of the same or another species are introduced into the body to fight the disease. Who are the primary focus groups of the IMI program? UNS. The primary focus groups of the Intensified Mission Indradhanush (IMI) program are the children up to 2 years of age and pregnant women who have missed out routine immunization. What is trachoma? UNS. Trachoma is a communicable eye disease which when left untreated it will lead to visual impairment or blindness. Name the 2 tablets which are distributed for the benefits of pregnant and lactating mothers. UNS. The 2 tablets which are distributed for the benefits of pregnant and lactating mothers are iron and folic acid tablets. What are the 2 main objectives of the National Leprosy Control Program? UNS. The 2 main objectives of the National Leprosy Control Program are the early case detection and the treatment given at the home of the leprosy patients with sulfone tablets. What is a PHC? UNS. A PHC is an institution for the promotion of both health and welfare of the people in the area of a community development block. It is the smallest agency adapted to serve the public health needs of rural areas, covering a population of 60,000 to 1 lakh. Name 2 statutory bodies related to medicine constituted by the Government of India. UNS. 2 statutory bodies constituted by the Government of India are Central Council of Indian Medicine and Central Council for Research in Indian Medicine and Homeopathy. In the science of curing diseases, what are the two areas of study? UNS. In the science of curing diseases, these are two areas of study, medicine and surgery. Who were the founders of the Ayurvedic system of medicine? UNS. Sushrita and Charka were the founders of the Ayurvedic system of medicine. How are diseases cured in Ayurveda? UNS. In Ayurveda, elimination of the toxins from the body and the restoration of internal equilibrium is done for curing the diseases. Unani system of medicine is based upon 4 humors present in the body. Name them. UNS. Unani is based upon 4 humors present in the body: Idoti, Swada, Safra, Balgam and Khoon. What is the main criterion of investigation in the allopathy system of medicine? UNS. The main criterion of investigation is to find anatomical and physiological deviations from the normal which manifest as a disease. What do the Indian systems of medicine emphasize upon? UNS. Indian system of medicine lay emphasis on dietary control and use of herbal and mineral drugs. How are diseases caused according to the Ayurvedic system? UNS. According to the Ayurvedic system, diseases are caused by faulty food, disturbance of mind and unhygienic habits. What is the law of similars in homeopathy? UNS. Homeopathy is based upon the law of similars called similia similibus curantur, which means like are cured by likes. Write any 2 points on the Siddha system of medicine. UNS. The Siddha system of medicine is mainly practiced in Tamil Nadu and some parts of Kerala. The basic principles of this system are similar to Ayurveda. Who is an uninformed quack? UNS. An uninformed quack has very little knowledge about what he/she intends to treat. However, he/she may not know that he/she knows nothing. What is a drug? UNS. A drug is a chemical or non-infectious biological substance which alters the body and its functions. What is chemotherapy? Who founded this system? UNS. Chemotherapy is the treatment of disease by administering chemicals. It was founded by Paul Ehrlich. What are non-prescription drugs? UNS. Non-prescription drugs are generally used in case of minor ailments such as headache, common cold and pain, but they are not to be used indiscriminately. What are the 2 important reasons for using drugs without doctor's advice? UNS. 2 important reasons for using drugs without a doctor's advice are lack of resources and lack of attitude. How do we know when to consult a doctor? UNS. Severity, persistence and repetition of symptoms should be used as criteria for consulting a doctor. What are the symptoms that may need immediate medical care by a qualified doctor? UNS. Symptoms like chest pain, blackout, nausea and unconsciousness may need immediate medical care by a qualified doctor. What is drug abuse? UNS. Drug abuse is defined as self-administration of drugs in excessive or inappropriate doses. It is the use of drugs or substances in a way that is harmful to an individual's health, relationships or overall well-being. What is alcohol? UNS. Alcohol, also known as ethanol, is a fermented organic liquid obtained by the natural fermentation of malts and sugars. It is the intoxicating constituent of wine, beer, spirits and other alcoholic drinks. What is quarantine? UNS. Quarantine is the period during which persons who might spread an infectious disease, especially travelers, are kept isolated. What is the main objective of the WHO? UNS. The main objective of the WHO is the attainment of the highest possible level of health by all people. Why life skills education is important? UNS. It is through life skills education that young adults would be guided in making some key life event decisions such as marriage, employment, bearing children and gaining acceptance in the community. What are life skills according to WHO? UNS. The World Health Organization defines life skills as the abilities for adaptive and positive behavior that enable individuals to deal effectively with the demands and challenges of every life. What is life skills education meant for? UNS. Life skills education is meant to enhance capabilities of adolescents and young adults to help them deal with many challenges of life. What is teenage pregnancy? UNS. Teenage pregnancy, also known as adolescent pregnancy, is one that takes place from puberty to the age of 19 years. What is an STI? UNS. A sexually transmitted infection, STI, is an illness caused by an infectious pathogen which spread from one person to another by means of sexual contact, including vaginal intercourse, oral sex and anal sex. What is infection? UNS. Infection simply means that a germ, virus, bacteria or parasite that can cause disease or sickness is present inside person's body. Why intravenous drug users are said to be a high-risk group? UNS. Drugs addicts who inject the drug intravenously are a high-risk group as they are often known to share the syringes among their fellow users. What is a cesarean section? UNS. A cesarean section is an operation to deliver a baby through its mother's abdominal wall, which reduces the baby's exposure to its mother's body fluids. What is the goal of physical education? UNS. The goal of physical education is to ensure that all students acquire the knowledge, skills and attitudes to lead healthy and active lives. Group C.